My name's Jessie. I'm a physical therapist and I specialize in pelvic floor physical therapy. So I am going. First thing is, a lot of people say, like, what happens on the first day of your pelvic floor physical therapy? So just like any other body part in physical therapy, the first day is the evaluation. So that's my time to listen to what you have to say, listen to your symptoms, and then also like your physical symptoms and like your story. So like any history, I ask about things like medical history, pregnancy history, any other injuries or accidents, especially relating to the abdomen, or the hips or the back tend to be very common. Like I have so many times people have problems with their pelvic floor and then they tell me they had an abdominal surgery, and then it kind of goes along with some of the symptoms, especially like core related symptoms. So that's super important. And then after we do, our interview, we do our physical assessment. Usually there's time. More experienced physical therapists will have more time towards the end of that first treatment hour to do treatment. So I usually try to give people one or two exercises, whether it's a stretch or a strengthening exercise to do at home to help with one of their symptoms, usually their most bothersome symptom, but sometimes it's not going to get fixed overnight. So sometimes it's a little bit of education on what's going on with their body. Most people really appreciate someone telling them what's going on, why they're having their symptoms, because either a doctor in the past hasn't been listening to them, or they have just been like, oh, you have, interstitial cystitis or endometriosis, and then they don't really explain what that means. So my job is to kind of explain the medical diagnosis if they came with one, or to give my opinion on what their physical therapy diagnosis is. So like what's causing their issues. And then if I can connect the two, I always try to do that. And then, like I said, if I have time, I'll do the treatment and then I'll give them an exercise or two to do at home. And then when they come in the next day, I go through, how was that? Do we need to change anything? Stuff like that. So the next question that people ask a lot is, what is a pelvic exam? How do you do that? So in my mind, there's two types of pelvic exams. There's an internal exam and an external exam. And so most people think about the internal exam, but the external exam I do pretty much on everybody, because not everybody will be open to or interested in an internal exam. A lot of people are, because they that's not something that people do very often to you, other than the gynecologist, and that's also limited in what they're assessing. So most people are interested in it, but sometimes for whatever reason, people don't want to do it, especially on the first day, and that's totally fine. So the external assessment is going to be looking at the pelvic region from the outside. So clothes are usually off. I'm looking at things like skin integrity. I'm looking for, scarring, stuff like that. And then usually I'll also do some sort of palpation where I'm assessing the muscles from the outside. Or I can be, touching different bony areas or ligaments and anything that I think is causing their symptoms, and try to reproduce it so that I know what's going on. That's in addition to the rest of the physical exam, which is going to include, depending on the body part, but usually for the pelvic area, I'm going to look at their back, I'm going to look at their abs, and do some tests there. And I usually will look at their hip as well, because that tends to be interrelated. So usually I'll start with the interview, and then I'll explain to them what I'm going to do. And then I'll move on to the external exam, which is the whole body exam. And then also, as long as they consent and they're interested in doing the pelvic exam, we'll do the external pelvic exam, and then I'll let them know that at that point we will move on to the internal exam if they want to do so. For the internal exam, usually that is in the same position as the external exam, and they already have their clothes off. So if they've consented, that will usually be vaginal for women. For men, it has to be rectal if you're going to do it. For some women, you can do rectal instead of vaginal if there's a reason you need to. But yeah, so the position is a little bit different, but the internal exam is also going to be looking at reproducing their pain. It's going to be assessing their muscles from the inside. And then the bones too, like your coccyx and all those other bony landmarks, but from the inside. I typically don't assess organs like the uterus or anything like that, just because I don't have experience doing that. I think you can take classes where you can do that, but that's more a gyno thing. Like if I think you're having a uterus issue, and not a myofascial or muscular issue or a skeletal issue or a nerve issue, I'm probably going to send you back to your gynecologist. So, do all pelvic floor therapists do internal exams? It depends. So, you can be a pelvic floor therapist and stick to just the external pelvic exams. There's a lot of different reasons why that might happen. Number one, I would say your qualifications. If you're not qualified or you haven't learned and practiced how to do an internal exam, and that's vaginal or rectal, then you shouldn't be doing one. So you need to take a course that's been vetted and it's very well known and prestigious. That way you know that you're learning what you're supposed to be learning and you're not missing out on anything. But then also because you when you take that class, you have to practice on each other. So if you that way you know what it feels like. It's very interesting. I love the lab experience because it really gives you the chance to understand how intimate that relationship is with your patient, because if you're getting an internal exam, that person is really putting a lot of trust in you, especially if that person has pain. So having that experience of being the patient as well as the practitioner, I think is very valuable. And so if you haven't taken that course, you can't just do it based on book anatomy. I would not recommend that for anybody. This kind of goes along with that, but there's different courses that you can take. So when I first took my vaginal course, I was not doing rectal assessments. I waited until I took that course and learned and practiced how to do that before I could do that to somebody else. So you have to make sure that your pelvic floor therapist is qualified, has taken the courses, and knows exactly what they're doing. On top of that, it also depends on the experience. So maybe I've done it one time, but I don't feel comfortable. As a practitioner, I'm not going to do anything that I don't feel comfortable doing. So I'm not going to advertise that service as something that I provide if I don't feel like I am going to be getting anything out of that. I'm not just going to stick my finger in any of my patients' vaginas just to say that I did it. I'm going to go in with a plan. I know exactly what I'm doing. My patient knows exactly what I'm doing. And then the other thing is that the patients, it's going to depend, right? So number one, you have to get consent, and you're getting that all the time. You're getting it in writing. You're asking them, do you feel comfortable? You're watching their body language, because someone might say that they're comfortable, but really isn't. So it's really a skill that the practitioner has to develop in order to decide who is an appropriate person to be internally evaluated. You're not going to evaluate someone who is not mentally able to give you consent. If there is a history of trauma, either that the patient has disclosed or that you start to notice. And there's a lot of other things that you can do before that. Like you might have a questionnaire in your intake paperwork that gives you a clue that somebody has been through either sexual trauma or any kind of physical trauma. That might be the person you want to wait a couple of visits on, and then make sure that they're comfortable the whole time. If you have any sign that they are, starting to detach, you need to stop the exam. And I always give my patients the options throughout the evaluation. I say, even if you say yes later, I'm going to ask you again. I'm going to constantly be asking you. If at any point you want to stop, you let me know. The other thing is for pediatric patients. So I personally don't feel comfortable treating pediatric patients because I haven't had enough experience with that. So I don't see pediatric patients. Typically, if it's a patient that's very young, like let's say less than 10, I'm not doing a pelvic exam. If I am, I would definitely have a parent or guardian in the room. Typically, we don't do pelvic exams on pediatric patients, especially if they have never had any sort of internal exam before. So if it's a girl, let's say a teenage girl's never been to the gynecologist, I'm not going to be the first person to do that to them. And honestly, I would say even if it's an adult, if they've never had any sort of internal assessment, I might want to refer them to a gynecologist before I do that. But I think there's a little bit of discretion there. The next question that people ask all the time is, do I have to shave before pelvic floor physical therapy? And the answer is no. I typically tell people it doesn't matter. I'm not looking at your pubic hair. My goal is to assess the internal and external structures, and the hair doesn't really affect me. So whatever you feel comfortable with, if you feel more comfortable shaving, go ahead. If not, don't worry about it. It really is just not something that we're thinking about. The other thing, I don't even like the way this is worded, but I'm gonna say it because this is the way it was worded, is, do they finger you in pelvic floor therapy? And the answer is no, because when we are using, let's say it is an internal vaginal exam, you're really only using one finger. You are specifically targeting structures to assess, whether it's tight or whether it's painful. Typically, I'm not going near the clitoris. I'm not going very deep. Typically, it's 1 or 2 knuckles. And there's not a lot of confusion or movement of my fingers. My goal is not to create pleasure. It's to do specific assessments if I'm doing an internal exam. Another question that I think is interesting, but I'll go over it, is do you have to get undressed for pelvic floor therapy? So typically, my patients really only have to undress from the waist down, and it kind of depends on what you're wearing. If you're wearing a dress or a skirt, you don't necessarily have to take, that off. If you're doing an internal exam, then I would say, yes, you definitely have to take, you have to disrobe from the waist down. If you're doing an external exam, that's an external pelvic floor exam, then you will have somebody take their clothes off from the waist down, underwear. I usually say you can leave your socks on, you can leave, your sweatshirt on. If you're doing just like a hip assessment or just an abdominal assessment, you don't necessarily need that person to get dressed. So it kind of depends on what you're doing that day and what you are planning to do or what you're planning to assess. So usually pants, underwear off, everything else stays on, but that's really if you're doing a specific pelvic external assessment or definitely internal assessment. What position is needed for pelvic floor exams? So usually for an internal vaginal exam, I will do that with the person lying on their back with their knees bent. So I have a treatment table. So I usually will just have someone lay down on the table, with their head up at the top. It's a little different than at the gynecologist. Your feet aren't in stirrups. You're usually laying down, and I give you a sheet to cover yourself with. Some therapists have, what are they called? Robes, like exam robes. I don't do that. But yeah, it's usually common to have something to cover the patient with, either a disposable sheet, which is what I use, or, cloth sheets that the people launder. If I'm doing an internal rectal exam, so whether that's a female that I'm assessing rectally or a male patient, I'm going to do that usually on their side. That's the position that I learned it in, and I find it comfortable for me. I also know that you can do it on your belly, and that just has different advantages. Different muscles are relaxed versus working. For the vaginal exam, you can also do it on your hands and knees or in standing. So if the patient was pregnant, for example, and they can't maybe lie flat on their back. Depending on what you're testing, you can do maybe even side lying. I probably wouldn't do that for the vaginal exam just because it'd be a little bit harder to get to that area, but definitely hands and knees or standing would be accessible for that type of patient. If, for example, they can't lie down because they have COPD or, whatever the case is, they can't lie on their side, there's always another position that you can do it in. But I would say for the internal rectal exam, the side lying is the most common. And for the internal vaginal exam, the most common position is laying down on your back. Does a pelvic exam hurt? So, to be honest, sometimes it depends. Like I said, my goal is not to harm or hurt a patient. One, because I want them to like me, but also because I don't need to do that. I am looking to reproduce their pain, just to find the pain source if there's something specific that I'm looking for. But in general, I'm not poking and prodding and trying to cause discomfort or pain. If you are in a state of significant pain when you're coming in, then a pelvic exam is probably going to hurt. If you're not really in pain, but there's something else you're worried about, like incontinence, for example, then the pelvic exam might not be painful. It depends on a lot of different factors. Typically, if I see that someone is in an amount of pain that is not tolerable, I'll always say, if this hurts, I can, let me know, I can stop. If you want to stop, let me know. So, we're not trying to cause any pain. And usually if there is some sort of pain, I try to do something in my treatment that's going to alleviate that. So I might reproduce the pain during the initial pelvic assessment, and then I'll go and do, an exercise or a stretch or a manual technique even to help, relieve that pain, so that they're usually leaving, in a more comfortable state than they came in, hopefully. And that goes with any orthopedic patient as well. Okay. What do you do at pelvic floor physical therapy? So obviously for the first day, the assessment is going to take up a larger portion of that treatment session. My treatment sessions are typically an hour. I've seen, 30 minutes. I've seen 45 minutes. 30 minutes is kind of a short time, especially with pelvic floor therapy. You have to give people time to, use the restroom, change, get comfortable. You kind of talk with them a little bit about what you did in the past. So it always kind of varies, but in general, I'm going to do some shorter, quicker assessments. If there's one specific thing I want to look at or something that I didn't get to the time before, I might start with that, whether that's an internal sort of assessment or something external, even if it's the hip. But that's usually going to be, 10, 15 minutes maybe, as opposed to during the initial evaluation. That assessment portion is going to take a lot longer, especially if it's the first time and not like a reassessment. After that, I typically spend more time on exercises. So we might be doing local exercises specifically for the pelvic floor, or we might be doing global exercises that are incorporating the pelvic floor or something related to it. For me, that tends to be the area that I spend the longest in because I think it's the most valuable. I think it gives the patient the most amount of autonomy and ability to make a difference in their session. And it really empowers the patient. And for me, that's super, super important because me and the patient are a team. We are working together. I'm here to show you and guide you on how to manage or treat your symptoms, but I can't go home with you, although some people wish that I could. So as much as manual therapy might be helpful, I think the exercises, whether it's strengthening exercises or stretches, is the most valuable to me. Sometimes we'll do manual therapy, and like I said, that might be something external. So, for example, glute massage, hip mobilizations, like joint mobilizations. It could be internal work to help release muscles internally. Mobilizations, for example, to the coccyx. So it really just depends on what your symptoms are. We develop the plan of care after we kind of assess your symptoms, and what your treatment is going to be, and then we kind of go in with the plan. So not everybody's going to get manual therapy. Not everybody is going to get, exercises. If you're in a lot of pain, I'm not going to start with doing something that might trigger you. So it really depends on the person and kind of what we discover together. And the last part that I think is really most important is the education. So I'm always telling my patients why we're doing what we're doing. I think that really helps people understand the importance of what they're doing. So it's not like, oh, she told me to do this, that, and the other thing. Like, you're doing this exercise for this reason. So I think that's really important. Again, we're also talking about education on the medical diagnosis if you have one. If you have interstitial cystitis and you have no idea what that means, I'm going to spend the time and explain that to you and how it's relevant to your symptoms, because I think that's important. I would hope that everybody would do that. I'm not sure. So it kind of depends. But I think the education is really, really important as well. And that can be really quick. That can be, here are a couple tips to work on constipation. I've also spent like 40 minutes talking about constipation. So it really depends on the patient. It depends on how you're feeling. If you're like, I really can't do exercises today, we might spend more time doing some education or, some more restorative stretches, stuff like that. So going along with that, how long does pelvic floor PT take? Typically, my sessions are usually an hour. So it really depends on the treatment. If someone needs to come in 15 minutes to do a manual treatment and then they have to go on vacation, then your treatment is 15 minutes. But typically, I try to divide my sessions into quarters, and usually that's 10-15 minutes for each thing. So I typically won't spend more than 10 to 15 minutes on manual treatment because, again, I value some of the other stuff that I use in my toolbox more than that. But and also it doesn't really take that long. Maybe I'll do some manual work on your back and then internal vaginal work, that might take 30 minutes. But I'm never typically doing the same technique for more than 15 minutes. Usually, like I said before, the large chunk of time that I spend on is the therapeutic exercises. So stretches, strengthening exercises, specifically for whatever you came in for. So if you need strengthening exercises, we're going to do strengthening exercises. If you need lengthening exercises, we're going to do those. So not everybody gets the same exercises, and some people get similar exercises, but for totally different reasons. So that's why it's really important to see somebody in real life as opposed to just seeing videos online, because it's really important for the exercises or your treatment to make sense for what your symptoms are. And so when you see exercises online, sometimes they can make things worse. So it's really important to do what you need to do. And you're also going to get faster that way, instead of kind of, throwing spaghetti at the wall or whatever that saying is and seeing what sticks. Like, if you get specific exercises for your specific impairments, your treatment and your recovery is going to be a lot faster, and it's usually going to be a lot more comfortable. You're not going to have to go through, oh, this didn't work. I mean, sometimes, not everything works for everybody. So something that works for someone might not work for somebody else. So we try it. And that's always why I'm communicating with my patients. I'm trying to ask them, did you like this? Did you not? Did this help? Did this make things worse? So things are changing all the time, which is also another reason why I think it's really important for people to come frequently, because we can make those adjustments. If I see you once every 3 weeks, I might not be able to make those adjustments. And then you might be doing something that's inappropriate for you, or it might just take longer because you do the same thing for 3 weeks as opposed to I can change it immediately. But it also depends on people's finances and their schedule. So, I do whatever works for you because I just want to help. And as long as you're doing what you need to do at home, usually it goes well. Okay, so what are the disadvantages of pelvic floor physical therapy? So I am biased because I'm a pelvic floor therapist, but I really don't think there are disadvantages to pelvic floor therapy. The one that I thought of was that I guess they could make things worse. I think if you have somebody that does an appropriate assessment and has the training, they typically won't make you worse. They'll usually make you feel better fairly quickly. But if you have someone who doesn't know what they're doing, or they didn't assess and they just kind of assumed and gave you some random stuff, that potentially could make things worse. So like I said, if you Google, pelvic floor exercises and you're doing a bunch of Kegels and you're a pelvic floor contraction and you're already hypertonic or have increased tone, that's going to make things worse. And then, it's going to take you even longer to kind of get back to neutral and then to improve. So I would say there's no disadvantages to getting pelvic floor therapy from someone who's qualified. There might be some disadvantages of pelvic floor exercises if you're just kind of winging it, or, doing things that your friend might say might not even be the right thing for you. So it really does depend on each individual person. The other thing that I just thought of that might be a disadvantage, but I don't know if it really is you might get, triggered, especially if you have a history of trauma or if you've been repressing anything. People get very, very emotional during pelvic floor physical therapy sometimes, especially if they have a history of trauma, especially if that trauma is sexual trauma. So I think it's important for your therapist to understand that, because like I said, if you're doing an assessment and someone starts to kind of spiral, even if it's just like their eyes go blank and you realize that they're really not appreciating it or able to go through with the rest of the session, in that, at least that aspect of the session, you need to be able to know how to respond to that and ask the right questions. Not everybody's going to want to talk about their trauma or their history, so you really just have to be there to listen, and then if they disclose anything, answer appropriately depending on what they say. I would say usually if I notice that someone has a history of trauma, or if they're not dealing with it well, I'm obviously going to avoid the things that I know are not beneficial to their treatment, but I'm going to recommend a mental health professional, because that is within their scope of practice. They know how to help you kind of work through all those emotions. I'm really just going to hold space to allow those things and let you know, it's very common, it's normal, everything's going to be, okay. But I typically don't want to get someone to that place, but if they are, I know how to respond. So some people might see that as a disadvantage because they're having kind of a negative reaction. But, hopefully that's not something that is happening often. And if you know that that's going to happen, then you should be choosing a different treatment method, whether it's that day, like it might be just one random day they're really having a rough time, and that's not the day to do that type of treatment. So it really depends. You have to take it day by day, and you have to listen and be super aware, which is where a lot of the training comes in. So there's a lot of courses specifically about trauma and trauma-informed care. So you just want to make sure that you have a practitioner that is aware of all those things, and it's not just someone who's just like, I'm going to do pelvic floor therapy just because. So the last question that I have here is, does pelvic floor physical therapy make you tighter? So I'm assuming this is referring to your vaginal tissue. And so my answer is yes and no. So if you're going to pelvic floor physical therapy and you have increased vaginal tone, your muscles are tight for whatever reason, my pelvic floor therapy is not going to make you tighter. That is going to make your symptoms worse. My goal is to do things that are going to take you from that high tone and decrease it to a more normalized tone. So we're going to do, breathing techniques. We're going to do manual techniques if you're open to it. We're going to do stretches, things that are going to calm you down. On the other hand, if you're somebody who has an underactive pelvic floor condition, so you can think pelvic organ prolapse, you can think urinary incontinence, those people typically, and not always, but typically will have decreased tone in their pelvic floor. Those people I might be giving exercises to, and it could be an exercise that's going to indirectly strengthen the pelvic floor, or directly strengthen the pelvic floor. And in that case, that would be a pelvic floor contraction, which is also called or known as a Kegel. So it depends on your symptoms. It depends on the treatment technique and your diagnosis. It's common for some people with urinary incontinence to also have an overactive pelvic floor, which actually means that they have increased tone. So like I said, even if you have a specific diagnosis, your presentation in the clinic might be different than somebody else's. So your treatment has to be very, very specific to you, your history, and your symptoms. That people have asked are, what should I expect at a pelvic floor session? So this kind of is similar to what do you do at the pelvic floor therapy, but what I would say when I am working with the patient, the first thing that I do is I talk to them about what we did last time, see how it went, how it felt, if they had any problems, if they have any questions, if there's anything that they want to go over before we move on to new stuff. I like to start with my manual treatment. So if I'm going to do manual treatments, unless I know I'm going to do something that might trigger them and then I want to save the manual treatment for the end. But typically I'll do it at the beginning, and then I'll spend the rest of the time. So whether that's, 30 minutes, 45 minutes is doing the therapeutic exercises. So I usually will look and make sure that they're doing the exercises that I had them do last time. A lot of times people come in and they do something totally different or they don't remember. So I want to make sure that it looks like what I expect it to look like. And then if that's the case, I usually will progress that exercise depending on the kind of goal it is. If it's an exercise that they say that, really, really aggravated them, I'm not going to progress that exercise. I'm either going to make sure that they did it right, because if they did it wrong and that was what was causing their pain, I'm going to let them know that and give them corrections and feedback. But if it's just an exercise that, doesn't work for them or it's too advanced for them or they just don't like it, I'm going to give them an alternative, because I want them to do their exercises. And if they don't like it, and they're not going to do it, then that's pointless. And then at the end, I'll usually make sure that they're scheduled for another session. And I'll tell them what I expect them to do next time, for next time. So I'll give them, these are the exercises that we changed, or I don't want you to do this one, or I just want you to practice this, or I want you to look this up. And then that's pretty much it. So that usually it goes by really fast. An hour is, like I said, my usual treatment time. I've seen people do 90 minutes, and I've seen people do 45. So it really just depends. But typically when you're with me for about an hour. How do I prepare for pelvic floor physical therapy? So I guess it would depend on if it was an initial evaluation or if it was a regular follow-up. So I would say if you are coming in for your first visit, I would definitely have any kind of medical history, especially if it's relevant. Some people really don't remember a lot. If you have a prescription from your doctor, I like to see that. Sometimes it has a diagnosis on it. Sometimes it just says pelvic floor physical therapy. But usually I'll tell people to bring in, a prescription if they have it, any imaging that they might have. Let's say they have an x-ray or an MRI. It's not necessary, but if they have one and they want me to look at it or just have it for their records, the more information for me, the better, because I can then choose what I think is relevant and what isn't. But you don't have to go out and get an x-ray. I would say make sure you're clean, especially if you're going to have a pelvic assessment. If you are, so this is actually something that wasn't sent in, but I think it's very common, is during your cycle, if you're menstruating, a lot of people ask me, should I come in? Should I wait? Menstrual blood does not affect my ability to do an internal assessment. However, if you don't feel comfortable because either symptomatically or it's just gross to you, I say, wait, we'll do it next time. It's not a big deal. Usually if you are wearing a tampon, we'll have to take that out, or, a menstrual cup. So I would bring an extra if you like to use that. I have some, but not everyone might. So it's good to bring an extra. And that's been a problem where I haven't been able to do it because someone has clean clean. Like I said, grooming is up to you. But I would say, be clean just because you probably should be. But it's really not that big of a deal. I've had people who are like, oh, I just came from the gym. And I'm like, I don't care. It's fine. The other thing I would do, things like this can be helpful, but I think just Googling, especially if you've never been to physical therapy in general, I would look up what a physical therapy session looks like or what a pelvic floor therapy session looks like. Because like I said, some people are different. I would probably ask specifically the therapist that you're going to see, do you need me to bring anything, or is there anything I need to do to prepare? And if there's anything specific that practitioner wants, then they'll let you know. But in general, I would say, come if you have medical information, bring it. If not, it's not a big deal. Okay. I don't know if I answered this question. I think I might have answered a similar question. So one of the questions is, how long does a pelvic floor assessment take? And if I went over this, maybe some of you weren't here, but so the pelvic assessment itself has two parts, the internal assessment and the external assessment. So I would say in general, it will take probably 15-ish minutes to do the physical assessment. So that's going to go over things like posture and hip range of motion and abdominal strength. And then the external portion of the pelvic exam, it usually only takes around 10 to 15 minutes to do the internal assessment. It kind of depends on what I'm checking for. If I'm doing the whole entire gambit, it might take 15 minutes. If I'm just going to assess, superficial muscles internally, that's obviously going to take a lot less time. I would say the most important part, especially for the internal exam, is you don't want to feel rushed. You don't want the patient to feel rushed, and you as a practitioner don't want to feel rushed. So if for whatever reason my subjective part of my exam, the interview portion, took 40 minutes and I only have 20 minutes, and for whatever reason I don't think that's going to be enough time, I'm not going to squeeze in my internal assessment really quickly. I'll just save it for the next session. So, because like I said, you're also assessing things constantly. So, if there's something that you really want to get done, but you don't want to have to rush it, I just move it over to the next session. And I usually explain that to the patient, and I say, I don't want to do this internal assessment in 10 minutes, especially if it's someone who's a little bit more involved. And also because it takes time to do things, like get undressed, clean up after. So those are all things you have to take into account. But typically, I would say the whole entire physical portion usually doesn't take more than 30 minutes, and it usually takes closer to 15. But it also depends on if you're doing the internal assessment as well. I think I answered, how long does pelvic floor PT take? I think I answered the rest of these questions. Let me just double check. The last one, this is kind of vague, but I'll answer it. Obviously, again, I'm biased because I'm a pelvic floor physical therapist, but one of the questions is pelvic floor PT worth it? In my opinion, 100%. I think a pelvic floor physical therapist is trained in a lot of things that other healthcare practitioners are not trained in. And even not all physical therapists have this information. So if you have someone that has a lot of training and a lot of experience, it is very, very worth it. I think even if you go to an orthopedic practitioner, there's a lot of things that they can do. Like even before I started taking my online courses, or not my online courses, my internal and external courses, I was starting to assess things. Like there's a lot of things that your orthopedic practitioner could do if they had the training. Abdominal assessments, totally within a scope of practice of a regular orthopedic physical therapist. Hip assessment, whether it's, the SI joints, the pelvic girdle, is within the scope of practice of a orthopedic physical therapist. Really, the only thing that I would say you want a specifically pelvic floor trained physical therapist to do is the internal exam, and the external exam if you're going to do it without clothes on. But there's a lot of different things that you can assess externally with clothes on that, you know, fall into the category of pelvic floor physical therapy. But it kind of depends on what your goals are, and what your treatment techniques are. Like if you want someone, you know, you had someone in the past say, okay, you need, internal releases. You want someone who obviously can do that, which isn't the case all the time. And then the other thing that I'll say is, financially, there's a really wide range of costs when it comes to physical therapy. Typically, for all physical therapy, an initial evaluation is going to cost more than a follow-up session. Like I said, typically they're an hour, but maybe if someone is shorter with their treatments, it's going to be a little bit less. It depends on the region that you live in, different towns, different states, if you're in a big city, if you're not, how many pelvic floor physical therapists are in your area, and also insurance. So I would say it seems like the majority of pelvic floor physical therapists do not take insurance. I don't take insurance, and that's just because I feel like I'm able to provide the services that I provide better when insurance isn't dictating how often I can see my patients, or which patients I can and cannot see. So to me, I would say, even though the cost tends to be higher, it's definitely worth it. I would say going in knowing what your finances are important, because then you can be very straightforward with your physical therapist and say, listen, I can't come, twice a week, but I can come once a week, or I can come every other week. That way your therapist knows and can adjust the plan accordingly. If you're just constantly going to cancel your appointments, either because, your schedule or finances or whatever, I have a plan for what I want to do. And it's also going to help me and you also understand how long it's going to take for you to get better. So I definitely think investing the money and the time into seeing a pelvic floor therapist, regardless of the frequency, is going to be of value to you. And I think that just discussing that with your pelvic floor therapist is going to give you both a lot of clarity on what needs to be done and what to prioritize as well. The other reason that I think it's worth it is because it's going to help you feel better. Whether it's a physical, diagnosis that can be treated, or if it's a chronic diagnosis that's something that you're going to have to live with. I always believe that you are going to learn something that you are going to appreciate, and that's going to improve your quality of life. So that might be exercises, that might be manual techniques, that might be education. So in my opinion, it's definitely worth it 100%. I've gone to a pelvic floor physical therapist and I've paid a lot of money, and I understand that it's very, very expensive, but I also, I knew what I was going to be learning. So I think what's really important is just doing things like this where we share what we know, because we know a lot of things and there's a lot of people that don't have this information. So if you have a friend who's, curious about pelvic floor physical therapy, share what you've heard and what you know and your experiences if you've had any. Because I think it's really important for us to share. The physical therapist profession in general is pretty unknown to a lot of patients, and usually to doctors as well. So the profession has changed a lot over the last couple of decades. We learn a lot of information, and we also learn a lot about who we can help guide you to if we are not the person. So I like to think of us as almost like a general practitioner, where we're kind of the first stop. If we see that it's something medical or something that someone else is better fit to treat, we're going to refer you to that person. But if it's something that's within our scope of practice, tends to be in the musculoskeletal system, but can include nerves, cardiovascular. There's so many different aspects of physical therapy. And I happen to love pelvic floor physical therapy. And so that's why I like to work with patients who need that, because it's a very intimate area and there's not a lot of people who are interested in doing that. So like I said, my name's Jessie. I have this beautiful private practice in Morristown. I also am a yoga teacher. I'm on Instagram and Facebook and YouTube. I have videos on YouTube. Those are more related to yoga, but I also have some anatomy education on there. And I hope to do another live. It might be another one like this where I'm just answering questions. I might have a certain topic, so go ahead and follow me if you want to be a part of that in the future. I also have a website. It's www.jessicamcnallydpt.com. My schedule is on there. I have a blog where I write about different topics, orthopedic and physical therapy. And then I also have an events page, so when I'm doing anything like this, that'll be on there. Yeah, so again, my email is jmcnallydpt@gmail.com. You can email me if you have any questions about anything that I said today, or if you have any other, common questions that weren't answered and you want answered. All right, so enjoy the rest of your night. Thank you so much for joining me, and I'll be posting this somehow when I figure out how, somewhere, probably Instagram, maybe YouTube. All right, take care, guys.